Left-handedness. Left-handedness is a natural variation in human populations, with only about 10% of the world's population being left-handed. So, out of every 10 people, approximately 1 person is left-handed. There's ongoing research into the genetics behind handedness, and while it's believed to be influenced by a combination of genetic and environmental factors, specific genes associated with handedness haven't been definitively identified yet. Some studies suggest that left-handedness might be linked to certain genetic variations, such as variants in genes like LRRTM1 or PCA6. These genes are involved in the development of asymmetry in the human brain, which could potentially influence handedness. However, the relationship between these genes and left-handedness is still not fully understood. Interestingly, there are many famous left-handed individuals across various fields, including arts, politics, and sports. Some notable examples include former US President Barack Obama, Microsoft founder Bill Gates, artist Leonardo da Vinci, and actors like Angelina Jolie and Tom Cruise. In sports, left-handed athletes such as tennis player Rafael Nadal and basketball player LeBron James have achieved great success. Sociopath. Sociopathy is a complex psychological condition characterized by a persistent pattern of disregard for and violation of the rights of others. They may disregard social norms and rules, leading to conflicts with authority figures and legal troubles. The causes of this are not fully understood, but both genetic and environmental factors are believed to play a role. Research suggests that there may be a genetic predisposition to antisocial behavior, but environmental influences, such as childhood trauma or neglect, also contribute significantly to the development of the disorder. Green eyes. Green eyes, which constitute approximately 2% of the global population, are most commonly observed in individuals of European descent, particularly those with Celtic or Germanic ancestry. This rarity is attributed to the intricate genetic interplay involving variations in the OCA2 and HERC2 genes, which influence the production and distribution of melanin in the iris. Despite their relatively low prevalence, green eyes captivate attention with their striking appearance, ranging from subtle olive hues to vibrant emerald tones, serving as a testament to the fascinating diversity of human traits shaped by genetics and heritage. Autism. Autism, formerly known as autism spectrum disorder, ASD, is a neurodevelopmental condition characterized by challenges with social interaction, communication, and repetitive behaviors. It affects individuals differently and is often accompanied by unique strengths and differences in cognitive processing. Recent estimates suggest that autism affects approximately 1 in 59 children, according to the Centers for Disease Control and Prevention, CDC, in the United States. However, it's essential to recognize that autism is a spectrum disorder, meaning that symptoms can range from mild to severe and vary greatly from person to person. Some individuals with autism may require significant support in their daily lives, while others may function relatively independently. Twin birth. Twin births occur when 2 offspring are produced in the same pregnancy. There are 2 primary types of twins: identical, monozygotic twins, who develop from a single fertilized egg that splits into 2, and fraternal, dizygotic twins, who develop from 2 separate eggs fertilized by 2 different sperm cells. The occurrence of twin births varies across populations and is influenced by factors such as maternal age, genetics, and assisted reproductive technologies. According to recent estimates, the overall incidence of twin births is approximately 1 in 85 pregnancies. Psychopath. Psychopathy, often referred to clinically as antisocial personality disorder, ASPD, is a complex personality disorder characterized by persistent antisocial behavior, impaired empathy and remorse, and bold, disinhibited, and egotistical traits. It's essential to clarify that not all individuals with ASPD are psychopaths, and vice versa, but there is an overlap between the two. Estimating the prevalence of psychopathy in the general population is challenging due to variations in diagnostic criteria and assessment methods. However, some studies suggest that the prevalence of psychopathy could be around 1% of the general population, approximately 1 in 100 individuals. White skin patches. Vitiligo. Vitiligo is a skin condition characterized by the loss of pigment in certain areas of the skin, resulting in white patches. It occurs when melanocytes, the cells responsible for producing pigment, are destroyed or stop functioning properly. The exact cause of vitiligo is not fully understood, but it's believed to involve a combination of genetic, autoimmune, and environmental factors. The prevalence of vitiligo varies across populations and regions. Recent estimates suggest that approximately 1 in 100 to 1 in 200 individuals worldwide are affected by vitiligo. Therefore, on average, it's estimated that vitiligo occurs in approximately 1 in 120 individuals. Vitiligo can affect people of any age, gender, or ethnicity, although it's more noticeable in individuals with darker skin tones. The condition can have significant psychological and emotional effects on affected individuals, including feelings of self-consciousness, low self-esteem, and social stigma. Different colored eyes. Heterochromia. Heterochromia is a condition characterized by a difference in coloration of the iris, the colored part of the eye. It can manifest as complete heterochromia, where each eye is a distinctly different color, or sectoral heterochromia, where there are variations in color within the same iris. Heterochromia can be present at birth or develop later in life due to genetic factors, injury, or certain medical conditions. The prevalence of heterochromia is relatively low, with estimates suggesting that it occurs in approximately 1 in 167 individuals. However, the exact prevalence may vary depending on factors such as geographic region and population demographics. While heterochromia is often considered a benign and visually striking trait, it can sometimes be associated with underlying health conditions or syndromes. For example, heterochromia may occur as a result of genetic disorders like Waardenburg syndrome or Horner syndrome, or as a side effect of certain medications. Extra finger or toe. Polydactyly. Polydactyly is a congenital condition characterized by the presence of extra fingers or toes. It can manifest in various forms, ranging from a small, harmless extra digit to a fully formed extra finger or toe with bone, joints, and nail. Polydactyly can occur in isolation or be associated with other genetic syndromes. The prevalence of polydactyly varies across populations and regions. Estimates suggest that it occurs in approximately 1 in 500 live births, making it relatively rare but not uncommon. The condition can affect individuals of any ethnicity or gender. Above 144 IQ. Having an IQ above 144 is considered exceptionally high and falls within the range of highly gifted or genius-level intelligence. Individuals with such high IQ scores often demonstrate exceptional intellectual abilities, including advanced problem-solving skills, creativity, and cognitive processing speed. Some estimates suggest that individuals with IQ scores above 144 occur in approximately 1 in 600 individuals. This means that these individuals represent a relatively rare but noteworthy segment of the population. While high IQ scores can open doors to academic and professional opportunities, they are not the sole determinant of success. Other factors such as motivation, perseverance, and emotional intelligence also play critical roles in achievement and fulfillment. Down syndrome. Trisomy 21. Down syndrome, also known as trisomy 21, is a genetic condition caused by the presence of an extra copy of chromosome 21. It is the most common chromosomal disorder, occurring in approximately 1 in 700 live births worldwide. Individuals with Down syndrome typically have characteristic physical features, such as almond-shaped eyes, a flat facial profile, and a small nose and mouth. They may also have developmental delays, intellectual disabilities, and various medical issues such as heart defects, hearing loss, and thyroid problems. However, the severity of these symptoms can vary widely among individuals with Down syndrome. Extra hands, polymelia. Polymelia is a rare congenital disorder characterized by the presence of extra limbs. These additional limbs can vary in size, shape, and functionality, and they may be fully formed or rudimentary. Polymelia is considered a type of congenital anomaly and can affect individuals of any gender or ethnicity. The prevalence of polymelia is relatively low, with estimates suggesting that it occurs in approximately 1 in 1,700 live births. The exact cause of polymelia is not fully understood, but it is believed to result from abnormal development during embryogenesis, possibly due to genetic or environmental factors. Tumor nerve growth. Neurofibromatosis. Neurofibromatosis is a group of genetic disorders that cause tumors to form on nerve tissue. The most common type, neurofibromatosis type 1, NF1, affects about 1 in 3,000 to 1 in 4,000 individuals worldwide. It typically presents with multiple neurofibromas, café au lait spots, and various other symptoms that can impact different systems of the body. Neurofibromatosis type 2, NF2, is less common, with a prevalence of approximately 1 in 25,000 to 1 in 40,000 individuals. It is characterized by tumors on the nerves that control hearing and balance, along with other symptoms like vision problems. Schwannomatosis, the rarest form, affects less than 1 in 40,000 individuals and is marked by multiple schwannomas throughout the body, leading to chronic pain and weakness. Small head. Microcephaly. Microcephaly, a rare condition where infants are born with abnormally small heads, occurs at a rate of approximately 1 in 5,000 births. This condition can stem from various factors, including genetic mutations, prenatal exposure to harmful substances, infections such as Zika virus during pregnancy, or environmental influences. Genetic mutations often disrupt normal brain development, impeding the growth of the skull and leading to developmental challenges like intellectual disabilities, delayed motor skills, seizures, and other neurological issues. Treatment typically involves specialized medical care, early intervention programs, and ongoing support to address the complex needs of affected individuals and improve their quality of life. Research into the causes and potential treatments for microcephaly remains ongoing, underscoring the importance of awareness, early detection, and access to comprehensive care for affected individuals and their families. Triplets birth. Triplet births, where 3 infants are born from a single pregnancy, are relatively rare, occurring approximately once in every 7,200 pregnancies. This phenomenon arises when multiple eggs are fertilized by multiple sperm cells, resulting in 3 embryos developing simultaneously in the womb. The occurrence of triplets can be influenced by various factors, including genetics, maternal age, and assisted reproductive technologies such as fertility treatments. While triplet pregnancies bring unique challenges, such as a higher risk of complications during pregnancy and delivery, advancements in medical care and prenatal monitoring have improved outcomes for both mothers and babies. Close medical supervision throughout the pregnancy and specialized care during delivery are essential to ensure the health and well-being of both the mother and each newborn. Albinism. Albinism, a rare genetic condition affecting approximately 1 in 17,000 individuals worldwide, is characterized by a lack of melanin pigment in the skin, hair, and eyes. This absence of melanin results in very light skin, white or light-colored hair, and light-colored eyes. People with albinism often face challenges related to vision, including photophobia, decreased visual acuity, and rapid eye movements. These visual impairments necessitate specialized eye care and visual aids to support daily activities. Additionally, individuals with albinism require sun protection due to their heightened vulnerability to skin damage from sun exposure. Despite these challenges, with proper medical care, education, and support, individuals with albinism can lead fulfilling lives and contribute meaningfully to their communities. Exposed brain. Anencephaly. Anencephaly, a rare and devastating neural tube defect occurring in about 1 in 20,000 pregnancies, results in the incomplete development or absence of the brain and skull in the developing fetus, typically arising during early embryonic stages when the neural tube fails to close entirely. This condition leads to babies being born with a significant portion of the brain missing, often limited to the brainstem. Unfortunately, infants with anencephaly are often stillborn or survive only briefly after birth due to the severity of the condition and the essential brain structures necessary for life being absent. While the precise causes remain incompletely understood, a combination of genetic and environmental factors, including maternal folic acid deficiency, is thought to contribute. Prenatal screening and diagnosis enable parents to make informed decisions regarding their pregnancy and access necessary medical and emotional support, while ongoing research aims to improve prevention strategies and supportive care for affected families. Blind and deaf. Usher syndrome and retinitis pigmentosa. Usher syndrome, encompassing various genetic disorders, and retinitis pigmentosa, a rare inherited condition affecting the retina, collectively impact approximately 1 in 35,000 individuals. Both conditions cause progressive vision loss, often leading to blindness, and may be accompanied by hearing impairment. Usher syndrome specifically involves a combination of retinitis pigmentosa and sensorineural hearing loss, affecting both vision and hearing over time. Retinitis pigmentosa primarily affects the retina's photoreceptor cells, leading to gradual peripheral vision loss that eventually results in tunnel vision, or complete blindness. While there is currently no cure for either condition, ongoing research aims to better understand the genetic mechanisms and develop potential treatments to slow disease progression and improve quality of life for affected individuals. Early diagnosis, comprehensive medical care, and access to support services are crucial in managing the challenges associated with these conditions and empowering individuals to lead fulfilling lives. Mermaid syndrome. Cyrenomelia. Cyrenomelia, or mermaid syndrome, is an exceptionally rare congenital condition affecting about 1 in 80,000 births. It manifests as the fusion of the lower limbs into a single mermaid-like appendage, often accompanied by severe abnormalities in the lower spine, genitourinary system, and gastrointestinal tract. Sadly, infants born with cyrenomelia typically face significant health complications and have a high risk of stillbirth or death shortly after birth due to complications like renal and pulmonary issues. While the exact cause remains uncertain, disruptions in fetal blood supply during early embryonic development are believed to play a role. Despite limited treatment options, early prenatal diagnosis through ultrasound imaging is crucial for providing parents with necessary information and support to make informed decisions about their pregnancy. Ongoing research aims to deepen our understanding of cyrenomelia's underlying mechanisms and explore potential preventive measures for this rare and devastating condition. Claw-like hands. Ectrodactyly. Ectrodactyly, a rare congenital condition occurring in approximately 1 in 90,000 births, is characterized by the absence or malformation of 1 or more digits on the hands or feet, giving them a claw-like appearance. Also known as split hand, split foot malformation, this condition can vary in severity, with affected individuals experiencing different degrees of limb abnormalities. Ectrodactyly may occur as an isolated anomaly or as part of a genetic syndrome. While the exact cause is not always clear, genetic factors are believed to play a significant role in its development. Although treatment options are limited, individuals with ectrodactyly can lead fulfilling lives with appropriate medical care, support, and interventions such as prosthetics or surgery to improve function and appearance. Early diagnosis and access to comprehensive medical and psychological support are essential for optimizing outcomes and empowering affected individuals to thrive. Singular I. Cyclopia. Cyclopia is an exceedingly rare congenital anomaly affecting approximately 1 in 95,000 births, characterized by the development of a single eye in the center of the forehead, often accompanied by severe facial and brain abnormalities. This condition arises due to a failure in early embryonic development, where the brain fails to properly divide into two hemispheres, leading to the fusion of the eye sockets and the formation of a single eye structure. Cyclopia is typically associated with other malformations, such as a single nostril, absent nasal bones, and a proboscis. Sadly, infants born with cyclopia rarely survive long after birth due to the extensive brain and organ abnormalities incompatible with life. While the precise causes remain unclear, genetic mutations or exposure to certain environmental factors during pregnancy may contribute. Early prenatal diagnosis through ultrasound imaging is critical for providing parents with information and support to make informed decisions about their pregnancy, though preventive measures or treatments for cyclopia are currently limited. Backbending knee, genu recurvatum. Genu recurvatum, also known as backbending knee, is a rare orthopedic condition occurring in approximately 1 in 100,000 individuals, characterized by hyperextension of the knee joint beyond its normal range. This abnormality often results in the lower leg appearing to bend backward relative to the thigh when standing, leading to instability, discomfort, and difficulty with activities that require weight-bearing on the affected limb. Genu recurvatum can stem from various factors, including congenital abnormality, ligament laxity, muscle weakness, or neurological conditions. Treatment typically involves a combination of physical therapy to strengthen muscles and improve joint stability, orthotic devices or braces to support the knee, and in severe cases, surgical intervention to correct alignment issues or address underlying structural abnormalities. Early diagnosis and intervention are crucial for minimizing complications and optimizing outcomes for individuals affected by genu recurvatum. Gigantism. Gigantism, a rare endocrine disorder occurring in approximately 1 in 125,000 individuals, is characterized by excessive growth and abnormally tall stature due to an overproduction of growth hormone during childhood and adolescence. This condition typically results from a benign tumor in the pituitary gland, known as a pituitary adenoma, which stimulates the excess production of GH. The elevated levels of GH prompt the bones to grow excessively long, leading to gigantism. In addition to accelerated growth, individuals with gigantism may experience other symptoms such as joint pain, enlarged facial features, and increased risk of cardiovascular and metabolic complications. Treatment often involves surgical removal or medical management of the pituitary tumor, along with hormone therapy to normalize GH levels and control further growth. Early diagnosis and intervention are crucial for managing the effects of gigantism and preventing associated health complications. Absolute genderless. Gonadal dysgenesis. Gonadal dysgenesis, an exceedingly rare condition affecting about 1 in 150,000 individuals, results in absolute genderlessness due to underdeveloped or absent gonads, which are responsible for producing reproductive cells. Typically presenting with ambiguous genitalia at birth, affected individuals face challenges in assigning a binary gender. This condition stems from genetic abnormalities disrupting gonadal development during fetal growth. Treatment often involves hormonal therapy and surgical interventions to address physical and psychological aspects of gender identity. Early diagnosis and comprehensive medical care are crucial for managing the complexities of gonadal dysgenesis and supporting affected individuals and their families. Conjoined twins. Conjoined twins, an extraordinary occurrence with an incidence of approximately 1 in 200,000 live births, captivate both medical professionals and the public alike. Originating from the incomplete division of a fertilized egg during early embryonic development, these twins are born physically connected to each other. Their connection can range from simple attachments to intricate configurations involving shared organs or body structures. Medically, conjoined twins present complex challenges, often necessitating individualized treatment plans tailored to their unique circumstances. While surgical separation may be an option in some cases, it requires meticulous planning and carries significant risks. Beyond the medical complexities, conjoined twins and their families also navigate social and psychological considerations, shaping their journey with remarkable resilience and determination. Red-plated skin, harlequin ichthyosis. Red-plated skin, a rare dermatological condition affecting roughly 1 in 300,000 individuals, manifests as red, thickened patches of skin. The condition's rarity often leads to challenges in diagnosis and treatment. Management typically involves a tailored approach, incorporating topical treatments, systemic therapies, and lifestyle modifications. However, beyond the physical symptoms, individuals may also grapple with emotional and social impacts, including self-image concerns and social stigma. Thus, holistic care, Addressing both medical and psychosocial aspects is essential to improve the quality of life for those living with red-plated skin. Quadruplets birth. Quadruplets, an extraordinarily rare event occurring in approximately 1 in 600,000 births, pose exceptional challenges and joys for families and medical professionals alike. The birth of 4 babies from a single pregnancy demands specialized care and support to ensure the health and well-being of both the infants and the mother. While the logistical demands and medical complexities are significant, the bond forged among quadruplets and their families is profound, reflecting the resilience and love that define their extraordinary journey. Skin overgrowth, Proteus syndrome. Skin overgrowth, also known as Proteus syndrome, is an exceedingly rare condition affecting approximately 1 in 1 million individuals. This disorder is characterized by the abnormal proliferation of skin cells, leading to thickened raised patches or larger extensive areas of overgrowth. Proteus syndrome presents significant challenges in diagnosis and treatment due to its rarity and variable presentation. A multidisciplinary approach involving dermatologists, geneticists, and other specialists is typically required to develop tailored care plans for affected individuals. Despite the complexities posed by Proteus syndrome, ongoing advancements in medical research offer hope for improved understanding and management of this condition in the future. Above 178 IQ. Having an IQ above 178 is exceptionally rare, with an estimated incidence of approximately 1 in 10 million individuals. People in this category are considered profoundly gifted and often exhibit extraordinary intellectual abilities across a wide range of domains. Such individuals may demonstrate exceptional problem-solving skills, rapid learning abilities, and advanced cognitive processing capabilities. However, it's important to note that IQ is just one measure of intelligence and doesn't fully capture the breadth and complexity of human cognitive abilities. While high IQ can provide certain advantages, it's also accompanied by unique challenges, including social and emotional considerations. Overall, individuals with IQs above 178 represent a remarkable subset of the population whose intellectual talents contribute to diverse fields and areas of innovation. Conjoined triplets. Conjoined triplets are an exceptionally rare occurrence, with an estimated incidence of only 1 in 50 million births. This phenomenon involves the simultaneous development of 3 embryos that fail to fully separate during early embryonic development. The medical complexities presented by conjoined triplets are immense, often requiring specialized care and extensive planning for potential separation procedures. Each case of conjoined triplets is unique, and treatment options depend on the specific circumstances and the feasibility of surgical intervention. Quintuplets birth. Quintuplet births are incredibly rare, occurring only once in approximately 57 million pregnancies. Managing such a pregnancy demands careful medical supervision and planning to ensure the health of both the mother and the babies. Logistically, the birth of quintuplets requires significant preparation to provide adequate care and support for all infants simultaneously. Emotionally, the journey can be overwhelming for parents as they navigate the challenges of raising multiple children at once. Despite the complexities involved, the arrival of quintuplets is a testament to the extraordinary possibilities of human reproduction. RH-Null blood type. RH-Null blood type is an extremely rare blood group, occurring in only approximately 1 in 175 million individuals. This blood type lacks all Rh antigens on the surface of red blood cells, making it valuable for medical research and transfusion medicine. Due to its scarcity, individuals with RH-Null blood may encounter challenges in finding compatible blood for transfusions. However, they can donate their blood to individuals with any Rh blood type, making them universal donors for Rh factor. Despite its rarity, RH-Null blood type exemplifies the diverse genetic variations within human populations. Treman syndrome. Epidermodysplasia verruciformis. Treman syndrome, scientifically known as epidermodysplasia verruciformis, is an exceedingly rare genetic disorder, occurring in approximately 1 in 375 million individuals. This condition results in a susceptibility to human papillomavirus, HPV infections, leading to the growth of wart-like lesions that resemble tree bark on the skin. These lesions can spread across the body, causing significant physical disfigurement and discomfort for affected individuals. Managing Treman syndrome often involves ongoing treatment to manage symptoms and prevent secondary infections, but there is currently no cure for the condition. Despite its extreme rarity, Treman syndrome highlights the intricate interplay between genetics, viral infections, and skin disorders. Werewolf syndrome. Hypertrichosis. Werewolf syndrome, scientifically known as hypertrichosis, is an exceptionally rare condition occurring in approximately 1 in 1 billion individuals. It is characterized by excessive hair growth across the body, resembling the appearance of thick, dark fur. This abnormal hair growth can cover large areas of the body, including the face, arms, and torso, leading to significant cosmetic concerns and psychological distress for those affected. While treatments such as laser therapy or hair removal creams may offer temporary relief, managing hypertrichosis remains challenging, and there is no known cure for the condition. More than 5 tuplets birth. The birth of more than 5 babies from a single pregnancy is an extraordinary event, occurring in approximately 1 in 4.7 billion pregnancies. This rare phenomenon presents immense medical, logistical, and emotional challenges for both the parents and healthcare providers involved. Managing such a high-order multiple pregnancy requires meticulous prenatal care, specialized medical interventions, and extensive planning for the delivery and postnatal care of multiple infants. Logistically, the birth of more than 5 tuplets demands significant resources, including neonatal intensive care units equipped to support the unique needs of premature or medically fragile babies. You, being a victorious sperm. As a victorious sperm, the odds of success are indeed staggering, with roughly 220 billion competitors vying for the same prize. Each sperm carries within it the genetic potential to contribute to the creation of a new life, but only one will ultimately achieve fertilization. The journey of a sperm cell is a remarkable tale of resilience, determination, and chance.